This morning, doctors are issuing a new warning to patients who are prescribed stimulant drugs like Adderall and Vyvanse. This comes from a new study published in the American Journal of Psychiatry. It found that taking high doses of these drugs, which contain amphetamine, could put people at a much higher risk of developing psychosis or mania.
In fact, one estimate shows that nearly a third of patients are prescribed dosages that may increase their risk of developing these psychotic symptoms.
NBC News medical fellow Dr. Akshay Syal joins us now to explain what this study found. Dr. Syal, good to have you with us. So walk us through which drugs were tested in this study and just how much of a risk doctors found they could pose to patients.
Good morning, guys. Yeah, so the link here between psychosis and mania and amphetamine stimulants isn't new. That's something that we've known for a while. But guys, what is new, just as of a few hours ago, is that we're sort of getting some information about what doses are required to sort of increase your risk here of developing those symptoms like psychosis or mania. And you can see here what we found is that, if you take more than these doses on the screen, so more than 40 milligrams of Adderall, more than 100 milligrams of Vyvanse, or 30 milligrams there of dexedrine, you have a 5.3 greater likelihood of developing psychosis, and that's what the authors considered here a high dose. There's also an increased level of risk for those taking a medium dose, which is sort of 20 to 40 milligrams of Adderall, about 50 to 100 of Vyvanse. So if you are somebody who's taking those doses, you just want to be a little bit more cautious, especially if you have a family history of somebody in the family who's developed psychosis or mania. You really want to be careful about how much Adderall or how much Vyvanse you're taking there, guys.
What is it about amphetamines that increases the risk for these severe mental health disorders? And is there anybody in particular who's more at risk?
So we're still learning that, Savannah, but our sort of best guess here is that it's, the neurotransmitter dopamine is what's involved. And so for those who don't know, dopamine is, it's the chemical we often associate with our reward center or pleasure center. It's involved in mood and attention and movement. But guys, in psychosis, we actually think dopamine is implicated because it's found in high levels. And so these amphetamine drugs can actually increase the level of dopamine in the brain. And if you get too much of it, that's what we sort of think is driving the association here, Savannah, but we're still really figuring out the exact reason why.
So we had a separate recent study that found stimulant use in U.S. adults skyrocketing in the last few years, up 30% for people between 20 to 39 years old. At the same time, doctors say developing psychosis or a similar disorder is quite rare. So just how much should this study concern folks?
Yeah, it's a good point, Joe. And so the overall risk is rare. It's about less than 1 in 1,000. But for those who are taking these drugs, and we're all in that age group. I'm sure we all here know people who are taking that, especially with, the COVID pandemic and telehealth and people sort of getting easier access. But guys, I think what people should really know is that if you do have a family history, if you do have, people in the family who've developed schizophrenia or bipolar disorder or psychosis, you really, really want to be careful about taking those higher medium doses. Because guys, I think a lot of people don't sort of get a lot of benefit if you start taking more and more stimulants. It's not really clear if it's doing much benefit for you, but it is increasing your risk. So it's really all about finding that balance and making sure you get the benefit from the drugs without avoiding some of that risk, guys.
For someone who's prescribed this, they're hearing this right now, they're thinking, oh, is my dosage too high? What could this mean? What should you do if you take one of these and you're concerned about your dosage?
Yeah, so it's I would say make sure you actually have a diagnosis or a reason for taking this. I think a lot of us know people who've gotten a hold of these drugs through non-prescription means, and so making sure you actually have an indication or a reason to be on it. And then Savannah, I would just I would tell people to get in with their doctor and making sure that that dose is sort of at that balance we just talked about, where it's making sure that you're getting the benefit with minimizing the risks and the side effects. And it's going to require some tinkering, playing with the doses a little bit, maybe trying Adderall, maybe trying Vyvanse, sort of figuring out which one's best for you. But as long as you're not taking that high dose for too long, you should be okay, guys. Again, the risk is very rare here.
All right, Dr. Akshay Syal, good to have you with us. Thank you so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.